All opposed? All right, ayes have it. We don't have a very heavy agenda today, so we'll go through our reports, and at the end, we have Monica from the Health Department presenting the Cure Violence Program. But we will start with the coroner. Thanks for coming, Jamie.
So my update is brief. Generally what happens in January and February is we go back into 2022 and we shore up all of our data regarding our most prominent types of deaths, being our homicides, suicides, infant deaths, and accidental deaths. Most often are drug overdoses. And so what we do is we take all of this data and we put it into a little nice package. And so when we come into March at this meeting, I'll be able to present you guys some data about what we did in 2022 and then make some comparisons to 2021 and even into 2020 where we can kind of show you like what's been going on in the community. One of the things that's come out of this data collection that we do is infant deaths. And I want to bring that up because it's something that we've carried from 2020 on until 2023. And we've only been able to do this with our community partners, and I'm going to mention Advanced Medical Transport as one of them, because they have provided us pack and plays for safe sleep. And so what that initiative has done for us is, first of all, we've tracked infant deaths. We know where they come from. We know where the highest incidence is, obviously in our most impoverished zip codes of the county, which is the 03, 04, and 05. So we partnered with our hospital systems, and what they've been able to do is to pinpoint our high-risk population people and connect us with them. So when they go home from the hospital, they have a mechanism to have their babies sleep safely, i.e. in a pack and play. So they discharge them from the hospital, they pick the pack and play up from us, or we deliver it to them, and it gives us an opportunity to educate on safe sleep. So it's, late February, heading into March, and we've given away and been able to give away 5 pack and plays. So that's 5 infants who are gonna go home from the hospital with safe sleep. And that's just like one of our initiatives that we're able to do. And so moving out, we'll continue to report on that. But the initiative is amazing, and so that's what our data drives do for us.
Okay.
So more to come.
That sounds like a great initiative. If there's anything the board can do to help with that, let us know.
Yeah, I
That's
appreciate
great.
that. We do have 18 community partners in our Infant Death Prevention Task Force, so everybody's got a hand in what we do. It's not a one person or a one entity thing. You know, the Peoria Fire Department helps us out a lot, the Peoria Police Department and the county. So it's a good initiative. We're preventing death instead of picking people up, you know. It's what we're supposed to do.
Great,
So.
thank you. Any
questions? Thank you.
I don't think so, thank you. All right, is Jody here? Oh, there you are. Thank you.
Good afternoon.
Hi there.
Hi, we are still working on Stark County at the ETSB. It's moving very slowly, not as quickly as we thought we were going to be doing, but hopefully next month we'll have more to report. Hopefully we can be started on this project as we were hoping to be started in January, but that's where we are.
I want to add a thank you to you and the team for our tour yesterday, I think that was, of the
Very
Bartonville
welcome.
Call Center. Both Nate and Danny and I, or the 3 of us, were at the Bartonville Call Center and learned how detailed and intricate everything is and the backup plans. It's nice and assuring to know that we have such a great team preparing for the unthinkable, I suppose.
You're very welcome. It was a pleasure, and if anybody else would ever like to attend, just get a hold of me at the ETSB office, and I would be glad to set up a tour for you as well. Any other questions?
Yes, Brian.
Thanks for organizing the tour. I'm sorry I couldn't make it, so I do appreciate it. I have been out there before several times over the years, but thank you for doing that.
All right. Well, thank you.
Thank you.
All right, we'll move on to Becky with PCAPS.
Well, good afternoon. I just wanted to give a brief update about our vet services at PCAPS. So if you'll remember, in the fall of last year, the board had approved us to move forward with a contract with Brown Animal Hospital and Dr. Brown for services beginning July 1st. So we are diligently working on that project right now. We are looking to secure a mobile unit, and I've been in touch with Dr. Brown, and he's looking to secure a veterinarian for us. So we're excited to move forward with that project. I don't have any resolutions or anything I'm bringing forward today, but soon enough you'll start to see that come down the pipeline.
I want to also note, I don't think I gave a shout out to you. We, Danny and I did a tour, and your staff work incredibly hard, and it made me want to fill my vehicle with 15 dogs, but that ultimately didn't work out. But thank you for all you're doing down there. It's incredible.
Thank you.
Does anybody have any questions for Becky or the mobile vet program? All right, well, we're moving right along. Thank you. Now we have the public defender report. Do we have Kevin?
Yes.
Thank you. So this is Kevin, our new public defender, and
Good
I will-
afternoon. My name is Kevin Lowe. I was appointed yesterday as the interim public defender of Peoria County. I'm humbled at this opportunity to serve the county, and we are very thankful to Nate Bach, our outgoing public defender, who of course served for a good 5.5 years. He did so very well, and we in the public defender's office are all so very proud of him now that he has become an associate judge and started his first day of work over in Tazewell County. As you can imagine, I just finished up my first 24 hours on the job, so I don't have much of a report for you. All I can say is right now I'm looking forward to serving out my term as interim public defender, which is of course a temporary position. I will be applying for the permanent spot as well, and I'll, on a personal level, keep my fingers crossed. So I may be addressing you more and more in the future. I may have a lot more information than I can provide for you. I know I've been relying a great deal on our wonderful office assistant, Kristen Collins, who holds everything. Well, actually, she runs our office. All right, so I know yesterday we went downstairs and took a look at the progress on our new office. So the old Recorder of Deeds space is being converted into the brand new public defender's office. And of course, we are all very, very excited about that. It looks like they're making some really good progress. It's pretty much all the demolition is done. It's cavernous. It's very large. Right now, we are dispersed in various areas of the courthouse. I'm in one location. The full-time felony people are in another location. Kristen's in another location. So we're really excited about getting an office space where we can be together and have the synergy of all of us being together come together in that one office space. So, and we're just very thankful for everybody on the board who's supported our efforts to become a more established, permanent, full-time public defender's office. So I think that's about all I can say right now, unless there are any questions.
To reassure everyone in the smooth transition, you've been with the county quite a while, right? Is that correct?
Yes, I have. I've been, well, yeah, I'll give you a little background. Me personally, so I graduated from Manual High School in 1988. I grew up over on Cooper Street, not far from Bradley. Then I went to the University of Illinois, studied economics there, an undergraduate degree there, and then I went on to law school at the University of Illinois. And upon graduation in 1995, after a short one-year detour in Chicago, I came back here to Peoria because I couldn't stand the traffic up in Chicago. So, but I came back to Peoria, and ever since I've been practicing law here in Peoria, so since 1996. And in 2001, I started my affiliation with Peoria County Public Defender's Office. I started working in my capacity as an independent contractor with the county, initially in the juvenile division. I did that for 3 years. Then in 2004, moved over to the felony division. And I was there until, as an independent contractor, until 2018. So I was an independent contractor, if my math is right, 17 years with the county. And then the last 5 years, I was Nate Bach's first assistant. And once again, I'm just honored and humbled that the circuit judges have appointed me as the interim public defender. And exactly, a short-term goal is just to minimize disruption to the courtrooms. We're doing everything that we can to make sure that our clients' cases are not disrupted and that the judges are getting the service at the level that they need it from the public defender's office.
All right, well, thank you. Any questions?
Ready?
All right, thank you.
Thank you.
All right, now we have our Cure Violence presentation that Monica has agreed to come give us.
Sure. First and foremost, thank you for allowing me to come and speak to the committee regarding the Cure Violence initiative. To give you a little background before diving into this assessment, in 2019, the Board of Health went through strategic planning. As a certified local health department, as well as a nationally accredited health department, we do continuous strategic planning every 3 years. In 2019, under the goal of health equity, they identified violence reduction as a key health priority, largely because in Peoria County, gun violence is actually one of the leading causes of death. And so with that, they tasked the team at the health department to start working towards identifying strategies and evidence-based interventions to decrease gun violence in our community. Through our research that we continued even through our COVID-19 response work, Cure Violence program kept coming up as one highly effective, as well as the data supporting the initiative continue to be mimicked in different communities and different cities. And so what we did in 2022 was start working with Cure Violence Global to bring the readiness assessment to Peoria, Illinois, to determine, one, if the violence we were seeing in Peoria was the type of violence that this type of intervention and program would align with, and then start looking at where we would be implementing it, as well as the type of resources and environment we would need. So I'll just kind of go through the slide deck. So first and foremost, Cure Violence is a public health approach to addressing violence. It follows under the idea that violence itself behaves like a contagious disease. So it has epidemic qualities to it. So if you, I say this rather, humbly, a lot of us have learned a lot about contagious diseases in the past few years, and how we transmit something such as COVID-19, how there's clusters, how it behaves and interacts, and how our relationship to others kind of can spread a virus. So with that same type of approach, looking at violence the same way, we see the same type of trends, that it clusters, there are waves, and there is actually a transmission point. And because if we start treating violence like we do a contagious disease or an epidemic, you can see types of results. So again, violence follows the same type of pattern as other public health issues we deal with. That there's clustering, there is waves, and there is a transmission point. In fact, even the issue that the coroner brought off, infant mortality, we see clustering of infant mortality in certain neighborhoods or geographic areas. Oftentimes you'll see that waves of infant mortality as it relates to PSAs about co-sleeping and things of that nature. And there's also transmission behavior. If you yourself perhaps was raised in a household that had that type of behavior of co-sleeping, you are also going to transmit it to yourself, and then your family learns that lesson and also continues that process. So we see this type of idea throughout. So the good news is we have tools that help us understand how to stop epidemics, including interrupting transmission, preventing future spread, and then changing our group norms. This has been very effective in this model that will kind of play on some of the largest public health successes that we've seen, such as the eradication of smallpox, decreasing of polio, and control of tuberculosis. So it starts off with, I think a little bit higher up, down. There you go. Interruption of violence. And so part of this is, one, finding individuals that live in our catchment areas or focused neighborhoods that are trusted, so they are credible. They can be validated, and what they are able to do is really reframe the conversation in these neighborhoods. So a great example is how we've used this in public health approaches has been for polio vaccinations. So in countries such as Afghanistan and in Pakistan, the way we got polio under control was we actually trained women in those villages to then go and speak to other families and young families about the importance and the impacts of polio and smallpox in these communities. So these were the interrupters. And so in the same model, you're using violence interrupters that, again, are coming from that catchment area, use their trust capital, and in turn are able to decrease the heat or the kind of conflict in an area. The next point includes really talking about changing behavior. So again, because they're trusted, they start meeting those individuals where they want and where they want to be, not where we think they should be, and start working with getting them resources, access to support, really changing how they're able to address the trauma they have seen and how they can adapt to it. And then the last part of it is really talking about the community as a whole. So changing the norm of the community. So you are responding to shootings. It's making sure that there's multiple messages that the community is hearing about why violence is unacceptable at any type of capacity in that neighborhood. So again, because we're framing it in a public health issue, we're really not talking about it in a moralism status, but in the science, that there is adverse circumstances, so the context that we see, the trauma that's ongoing in these communities, and then there's a transmission, the exposure. I don't think it's in this slide deck, but when we did have Cure Violence come through and do an assessment, they showed, I believe it was a kind of a Norman Rockwell sort of portrait, or kind of 4 pictures. It was, knowing this from Norman Rockwell, it is antiquated, but it was a boss yelling at his subordinate, and then that subordinate went home and yelled at his wife, and then his wife went home and yelled at their child, and the child yelled at the cat. The cat did nothing wrong, but the transmission and the exposure is something that our brains are able to do. And so again, it's really talking about it from the science aspect of it and not in this moralism aspect of it. So the readiness assessment was in 4 phases. The first was these Cure Violence global presentations that started in October, and we had them throughout our communities. We then met with key stakeholders, including some of our county partners, as well as city partners, faith-based leadership, employers, healthcare professionals. And then we actually visited with stakeholders and community groups to talk about the potential aspects in this. Again, this is all an assessment to see if Peoria has the capacity to put in this type of programming. And the last was the report and the budget, which is the slide deck. And we had a special Board of Health meeting in January that went over it, and I believe some of our county board members were able to attend that. So it answered, again, a couple of questions. Is there a government or non-governmental entity that has the capacity to do this? Does data exist? And again, the violence that we see, does it follow the framework of what Cure Violence Global is part of? And then again, do you have data that kind of provides criteria? Do you have community organizations or CBOs, because they're the ones that will actually be implementing this program? Will there be a workforce available to act as violence interrupters and outreach workers? And then recommendations on just the program size is part of the readiness assessment. So really hard slide to read, but these were all of the different Cure Violence 101 sessions that we had. And we had them at different times of days, evenings, lunch, across the board, different groups, just so that we had a variety of people that were able to make those different events. Overall, what they did find is that Peoria as a whole did have the capacity to take on this. We have both strong county and city leadership that would be able to play a role in this. Based on the data, they recommended that the health department be the oversight agency for this, and that's partly because this is a public health intervention. And then the next slides kind of go into further detail about the catchment areas. So what you see is the data that's actually coming from one of our biggest partners, which was the City of Peoria Police Department. Their crime analysts and data analysts provide us with a lot of data. And what they found were 2 candidates for catchment areas. The thing to note about Cure Violence and the data that comes from this, when you look at it, it's not citywide. It's not meant to be citywide. It would be great if you could, but that's a lot of resources. It really is meant to be a mile by a mile, really, catchment area, so that a violence interrupter can walk that entire catchment area one night, at least once, if multiple times. So the 2 candidates they saw was candidate 1 and candidate 2. 1 is East Bluff and 2 is Southside Peoria. So again, this data shows the number of murders, injuries, assaults, and shootings in our East Bluff area. And this is over a period of time. This is not 1 year, but this is multiple year data, partly because it's intended to be in the hottest zone, where the highest risk exists. And maybe to take a step back, when we talk about public health interventions, we talk about it as a pyramid. You have primary or interventions which are like normalized. Education, readiness, workforce development, kind of just basic interventions, clean streets, clean water, all of that good stuff. Then you have secondary, which is individuals that are high risk but not currently in that situation. So if you think about someone that maybe, we talk about sidewalks and parks as primary. Secondary is someone that might be pre-diabetic. So they, based on their weight or diet, they're not currently diabetic but are at high risk for diabetes. And then tertiary interventions are the people that are at the acute level, the ones that are currently like active, uncontrolled diabetes, where you would have to put a lot more resources and much more engagement. Similar to this whole model is focused on the highest acuity of violence. Those are currently actively involved in gun violence. And so a very specific population. So we want to be in the hottest zone. So target area 1, we see here, and then target area 2 is, again, south side of Peoria. You can kind of see on the far left side, Manual High School, if that kind of gives you some bearings on the west. And again, the data shows murders, injuries, assaults, and shootings. Now, between the two areas, they are very comparable. However, the discussion by the Board of Health as to which of the first requests for proposals to go out, they selected East Bluff. And that's primarily because, as this is a public health intervention, there's a larger population size in the East Bluff than there is in the south side. So there's more points of intervention and exposure that happen. And so again, this, and all this information is off of our website if you want more information about how it, so they did feel that the type of violence we saw was interpersonal, so again, fits the cure violence model, and that we did have stakeholders and community agencies that were available. And again, this is just kind of walks through all that we are able to meet through. The last part I want to get to is kind of what this model will look like, if you can keep going further down, Scott. Right here. So this is going to be what the program size and intervention is. So the health department, we are an oversight agency. So we are going to be really grant making to a community-based organization. It's the responsibility of the community-based organization who we will be working with, but they are the ones that will be hiring the project managers, the supervisors, as well as the individuals that are going to be interrupting violence, as well as outreach workers. So everything under that health department will be kind of granted out to a community-based organization. And so where we are at, again, is hopefully we have applicants that we released the bid already. The bids are due, or the requests for proposals are due today. And then from that, a evaluation team that will be made up of multiple sectors will choose a community-based organization that will actually start implementing this program in the East Bluff area. I think that is all. And again, these are just some other talking points that they had for us to walk through, but more than happy to answer questions about it. I talked really fast, I apologize.
Fine. Just in terms of understanding the program better, are the violence interrupters known to the community so that people can go to them, or is it more of a people kind of an undercover position?
Oh, it's they're known to the community, and that's the key thing to recognize is they're going to these individuals most likely have a history within the criminal justice system in some form. But the biggest thing is that they are trusted in their community. I might have a layer of trust, but in that neighborhood, I'm not from that neighborhood. I don't live in that neighborhood. So my credibility is not the same as someone that is actually have lived in that neighborhood and worked. They also, as violence interrupters, we recognize the fact that they're trading that trust capital out there. So this is not meant to be a side job, but we want to make sure part of the community-based organization, when they hire these violent interrupters, they are providing an income, they're providing health benefits. It is a career. Oftentimes in the communities, where cure violence happens, you'll see that individuals start as violence interrupters, and after a couple of cycles will move on to actually be program managers. And that's the intent of it, is to make sure that this is, you know, an economic opportunity for those people that are really out there putting themselves in a situation where they are trying to mitigate conflict.
Other questions about how the program works? I guess you're good.
Okay.
Thank you. I don't believe we have any public comment. Any miscellaneous? Yes, Brian.
You can stop me if I'm talking too long, but this is not a public safety matter or a health committee matter like we had with the previous meeting, but tonight at the Peoria City Council, there's a very important zoning case, and the petitioner wants to divide 90 acres into 4 different tracts, and our county zoning has already signed off on the subdivision plat, and the city has as well, but they're requiring a pre-annexation agreement. And so 300 to 400 of my constituents have signed petitions, and they're not all going to be there tonight. There's only like 4 or 5 of us that are going to speak, but we just oppose the pre-annexation agreement. So if you see it on the news, you'll know what's going on. I know Jimmy knows about it, and Terry knows about it, but I just thought I'd let you know.
Thanks for sharing. Any other miscellaneous? All right, can I get a motion to adjourn? All right, Brandy and Tanny, thank you.